They are complex glands that contribute to our physical and emotional well-being. If this area is avoided, it can be assumed that it is not as relevant or a necessary part of our body's overall health, and that's simply not true. Breast and chest massage therapy can provide that care in a real, safe, therapeutic manner. And I argue that it's crucial to our profession that we offer supportive, respectful touch to this most important area of the body in a way that many other professions do not. This touch is healing. Our breasts are often sexualized, yet we need to also approach them from a non-sexual way to uplift them or respect them, to normalize them as a natural part of our body's composition. We do so with all the other body parts, the neck, the shoulders, the arms and hands, the back, the hips, the buttocks, the legs and feet, the abdomen. We treat all these body parts with the attentions that they rightly deserve. Therefore, we need to expand our awareness as RMTs to become trained more fully in breast and chest massage therapy. My colleague Eileen Tran Mapletoft and I wrote an article for the spring edition of the Massage Therapy Media magazine, putting a call out to Canada from breast massage to breast and chest massage therapy, highlighting the need to emphasize not only the professional and therapeutic nature of the practice, but also the importance of using patient-centered language that respects, empowers, and protects the dignity of individuals. It is important that we become more knowledgeable and supportive in this way, since it completes the cycle of whole-body integration, a comprehensive approach to person-centered care. At present, not every massage therapy school in Canada teaches breast and chest massage therapy, and this needs to change. Breast conditions are just as relevant today as they were 25 years ago when Isabel McDonald and I sponsored Deborah Curtis to come to Vancouver to teach a breast massage workshop. She wrote a book on the same name, which I call my Breast Massage Bible. The majority of clients that come for breast and chest massage therapy are women, since most of the healthcare issues relating to the breast health are hormonal changes that occur throughout a woman's life, and also in response to the pressures in this sexualized society that are embedded in our culture. A woman's life trajectory starts out as a girl at puberty, and with that can come painful, congested breasts before and during menstruation. Then if a woman becomes a mother, there can be challenges during pregnancy with breastfeeding and weaning that need to be attending to. And as women move into early midlife, they can have a variety of benign changes, cysts, hematomas, abscesses, and enlarged lymph nodes, as well as other issues. In midlife, women who are menopausal or on hormone therapy or using hormonal IDs can have breast tenderness. And it is common for breast cancer to occur for women over the age of 50 and right up until they are in their elder or crone years. In 2025, one of the top women's health issues is breast cancer. It is a crisis for women, with 1 in 8 as a cumulative lifetime risk once women hit 80. When Deborah wrote the book on breast massage 25 years ago, breast cancer was a concern, as it still is now, but the main difference is that cis women are living longer post-surgery. As massage therapists, we can be one of the professions that most consistently helps to support women navigating and continuing through all the stages of their journey. We can offer relaxation massage to the whole body, including the unaffected breasts when appropriate, while always avoiding direct work on tumor sites. Since our clients are living longer after a cancer diagnosis, we as RMTs can provide ongoing cancer care, addressing chronic concerns such as lymphedema, scar tissue adhesions, pain, and fatigue. We can also assist in the physical and emotional integration that may come from treatment impacts, such as after the removal of a breast, and maintaining a good quality of life by encouraging tailored home care and therapeutic exercises that promote longevity and well-being. And when needed, we can provide compassionate palliative massage therapy care to bring comfort and dignity in the later stages. Of course, we can help our clients be proactive with assistance in breast monitoring, teaching them what ominous changes to look for and how to do breast self-exam and massage at home. Lymphatic drainage, circulatory pumping techniques, and pectoral tension release are key to keeping this area free from restrictions. The lymph vessels in the breast are considered to be valveless, so that is why manual therapy is so important to help clear the area of congestion. If we notice any breast changes that are potentially cancerous, we can refer them to their doctor for follow-up. Recently, there has been a rise in both breast reduction and breast enlargement surgeries. Reductions can be influenced by factors as wanting to relieve back pain and feeling like the breasts are too large and getting in the way of activity. Yet it can also be pressure to conform to the unrealistic beauty myths set by society. This holds true too for some women who want implants. Sometimes they have struggled for years with smaller breasts and want to feel more confident in their bodies. Yet again, it can be problematic if they are pressured to change their body parts without fully understanding their own motivation. I have worked with women who have had both surgeries, helping with their scar recovery, easing tension around the implant, and helping with the scar after they have had them removed due to contractures, breast implant illness, or dissatisfaction with them. Another area of concern is a rise of body dysmorphia, which can include breast dysmorphia, meaning an obsession of what the breast should look and be like. This can also link into eating disorders, which are disproportionately occurring with women who feel external societal pressure to conform to an ideal body image and weight, including the breasts. Body dysmorphia is rooted in a variety of factors, including increased sexual social media influence, and we can be there as massage therapists to help them with their support. Breast and chest massage therapy can provide support to our clients in terms of giving them permission to have their bodies and breasts touched in a safe, professional manner without judgment, which goes a long way to self-care. Many women have unrealistic expectations of what their breasts should look like, that they should be a certain size or shape, and while we can't tell them the answer to this, we as RMTs can certainly acknowledge that they are normal on the spectrum of all body shapes and sizes. For example, I regularly get asked questions about whether a client should get a breast reduction, and I talk it through with them about the pros and cons of it, of asking them how they feel about their breast size and its effect on their physical and mental health. The weight of their breasts can affect their posture, causing back and neck pain, curvature of the spine, and pressure into the abdomen. There is a breast appreciation scale that has been developed to determine how women feel about their breasts, which I feel could be a good tool for helping women to develop a healthy relationship with their body overall, promoting good health outcomes on a variety of levels. We as RMTs can play a role in encouraging body positivity, including supporting women to develop a favorable breast experience by simply acknowledging them and caring for them in a respectful manner. Having awareness of body and breast health can be important in detecting illness from a variety of breast health concerns. Another reason why breast and chest massage therapy is crucial to our profession is that many women have had some form of sexual trauma in their lives, and we can be the healthcare practitioners that can provide safe, effective, supportive touch to their whole bodies, and more specifically to their breasts, offering calm, respectful touch as we integrate it into their surrounding chest area. Being trauma-informed is key to working with the breasts and chest, acknowledging consent every step of the way, giving the client the choice to stop if they need to, and being clear on what the intention of the treatment is for them. If the massage therapist is aware of how trauma can affect the nervous system, such as through patterns of fight, flight, or freeze responses, they can attune to a client who may need more specific support in that moment. For example, if the therapist notices the client dissociate from their body, they can gently bring them back into the room and to the sensations that they might notice in their body in a safe, titrated way. Men do also get breast cancer, but it is less than 1% overall. However, because men don't often pay attention to this part of their body, it is often not discovered until it has progressed farther along. Thus, there can be a greater chance of morbidity. They can also have gynecomastia and breast pain. So we as a profession can encourage men to be aware of any changes that they may have in their breast tissue, such as lumps, swelling, or tenderness. And when clinically indicated, we can provide the appropriate massage techniques. If we find any abnormalities, we should refer our clients to their doctor. Transgender, non-binary, and gender-diverse people can also get breast cancer, especially those taking estrogen therapy. There hasn't been much research on it, but it is a relatively low amount compared to the rest for cis women. There has been an increase in trans people getting gender-affirming top surgery, which either means chest masculization, having a full bilateral mastectomy, or chest feminization, which means having an implant. Again, we as RMTs can be there to support trans people through these surgeries, to provide care before the surgery is done and afterwards, as we can attend to the mastectomy scars or implants by doing massage therapy, lymphatic drainage, scar tissue release, and other techniques. We as RMTs can take the lead in providing safe, effective breast and chest massage therapy in a more comprehensive way by acknowledging that the breast is an important part of our bodies, that the fascia, lymph, circulation, nerves, ducts, lobule, blood supply, and surrounding musculature can all be affected positively by our massage therapy, and that we can address many health concerns that may otherwise be ignored. I invite RMTs to consider offering breast and chest massage therapy as a treatment option in your clinic, recognizing its importance in supporting holistic health and wellness. I also encourage educators and schools to advocate for and offer comprehensive training in this area, both in foundational massage therapy education and through continuing education teachings. By supporting this work, our clients can receive safe, respectful, knowledgeable, and effective breast care, and as we as practitioners can be fully prepared to meet their needs with skill, confidence, and an attentive listening heart. Thank you.
Yay.